Here we are going to explain about Pheochromocytoma. What's Pheochromocytoma, what's meant by Pheochromocytoma, and what is the common signs and symptoms, and what causes it. We will going to explain this. What's Pheochromocytoma? Pheochromocytoma is tumor of adrenal gland. It occurs inside the adrenal medulla. We know that adrenal gland found over the kidney, and this tumor is rare and it's non-cancerous. It can be treatable. It's treatable, okay. And it leads to increase of catecholamine. We know that adrenal medulla secretes catecholamines, which is adrenaline, noradrenaline, dopamine, and DOPA. And this tumor lead to increase in these hormones. This tumor occur inside chromaffin cells. Chromaffin cells is found inside adrenal medulla in the adrenal gland, and tumor occurs in these chromaffin cells. But this chromaffin cells is not only found inside adrenal medulla, it's found also outside adrenal medulla, in heart, in neck, in head, along the spine, and it may occur outside adrenal medulla. Not only at adrenal medulla, but mostly of Pheochromocytoma is inside adrenal gland. It can occur at any age. Mostly between 20 and 50. This is adrenal medulla, and inside adrenal medulla is the chromaffin cells that occur the tumor inside it, where the tumor occurs, okay. And this adrenal medulla which produces the catecholamines. So tumor in adrenal medulla leads to increase in catecholamines, it leads to increase in hypertension, it leads to arrhythmia, maybe fatal hypertension and fatal arrhythmia. A cause of this tumor is mostly unknown, but it 1/1000 of hypertensive patients can be diseased, okay, and it may be hereditary. So if this type of tumor is hereditary, is it genetic? 30% cases are genetic, and researchers found that 10 genes are sites of mutation, and these genes control the age of this tumor and the location, if it inside adrenal medulla or outside it, the different secretions of adrenaline and noradrenaline and dopamine and DOPA, that are the catecholamine, and the malignancy. It may be cancerous and it may be non-cancerous. The most common symptoms are triad of symptoms: the hypertension, the tachycardia, and headache. And hypertension, tachycardia may be fatal. Other clinical symptoms may be sweating, blurred vision, chest pain, sleeping problems, and weight loss. Of course, this is due to the increase in catecholamine secretions. And other symptoms called café au lait spots. These spots are light to dark brown spots. It's painless, hyperpigmented, and flat area of patches. Its color is café. Here is it in the picture. Café au lait spots may be found in this tumor as clinical sign. Symptoms may occur from months to days, and duration is maybe from seconds to hours. Severity increase as the tumor grows over the time. Factors that may worsen symptoms: physical hard work that lead to increasing catecholamine, anxiety and stress, some medications as MAO inhibitors. Also, some types of food that containing tyramine may worsen symptoms like chocolate and some type of cheese and dried or smoked meat. How to diagnose this type of tumor? How to diagnose it? Maybe blood test and urine test to measure the catecholamine. In urine test, it measure catecholamine every time you urinate. Collect the urine samples every time you urinate. Also, CT scan using X-ray and MRI using radio waves for detailed image. Treatment: 90% of cases are successfully treated by surgical removal of tumor, and before surgery we need to give non-selective alpha and beta blockers, combination of these medications. For controlling hypertension, radiation therapy and chemotherapy are non-effective in this case. Complications: if this tumor is left untreated, may lead to many complications at heart muscle disease, pulmonary edema, cerebral hemorrhage, kidney failure, and eye disease. Suggest other topics to be explained in